Hello, everybody. Good morning, good afternoon. I'm Julie Harwell. I am the postpartum follow-through nurse here at the Fourth Trimester Resource Center, as well as the childbirth educator here. And we are so excited that you are joining us for our webinar today. We're lucky to have Kelsey Smith, who is a speech and language pathologist here in Ellensburg. She's also the owner of Summit Speech Therapy. The title of today's webinar is Infant Feeding from Birth to Introduction of Solids. There are going to be a lot of people who are going to be interested in what Kelsey has to tell us. So not only are we grateful for her being here to share her information with us today, her wisdom with us today, we are really happy that we have her as a resource in our small communities. It's pretty great that we do. Let's see, a little bit about Kelsey. She is, as I said, a speech and language pathologist and the owner of Summit Speech Therapy. She has a bachelor's degree from Portland State University and a master's from Abilene Christian University. She's passionate about pediatric feeding, including infant feeding, and has obtained ongoing education and training in this particular area. And when she's not working, when she's not helping our babies and children to feed, she enjoys any activity that gets her outside with her husband, her son, and her 2 dogs. So at this point, Kelsey, everyone, I'm going to go through a few disclosures that are important to start off with. I just want to ensure that there are no conflicts of interest for this activity. The information presented today is meant for educational purposes only. The views expressed are those of the presenter and do not constitute endorsement, recommendation, or favoring by Kittitas Valley Healthcare. And for medical advice, as always, please contact your healthcare provider. So Kelsey, I'm going to hand it over to you.
All right. Thank you for that introduction. And I'm excited to be able to share all this information with you guys today. So first of all, when you think of speech therapy, usually you don't think of feeding. Usually people think about children who have a hard time saying certain sounds. Let's see if I can move us to this corner here. There we go. So children who have a hard time saying sounds, maybe you have a grandparent or a parent who had a stroke or a brain injury and needed speech therapy. But one of the other things we get to do, which is less known, is help with feeding. And so for me, that means I work with lactation consultants, pediatricians, and local pediatric dentists to support healthy weight gain and develop appropriate oral motor skills for our infants. I help with problem solving when bottle feeding is not going as planned. And I help with the transition to solids. And that includes developing chewing and drinking skills. And then for our older kids, helping with picky eating. So some things I want to cover today include the feeding skills for birth to about 6 months, bottle feeding skills, what is typical and atypical, and when an evaluation might be helpful, bottle refusal, and then introduction to solids. So feeding skills in the first 6 months. So new research and studies have shown that in utero, swallowing is beginning as early as 15 weeks old. And then consistent swallowing of amniotic fluid in utero is seen between 22 and 25 weeks old. So this is really cool. And it really confirms what we already kind of thought, which is swallowing and that skill is just an innate skill. It's a reflex that they learn and they're born with. Around 2 to 3 months, however, that skill goes from a reflex to something that's volitional or that they have to choose to do. So at this point, it's really important to have developed really good breast or bottle feeding skills. We see that infants who don't have that good skill or try to learn the bottle after 3 months, or maybe who have only been like dream feeding or sleeping and eating at the same time, have a harder time. There's just kind of this click when things just get a little bit more challenging. So that's an important window for infants. And then moving forward a little bit, so the 4 to 6 month range, a lot of development happens for our motor skills, including our oral motor skills. So infants begin to sit up supported and then independently. Core strength is really important for feeding. Our infants start to reach for the bottle or spoon when they're hungry. They open their mouth when a spoon or bottle is presented or touches their lips. And the tongue moves food to the back of the mouth to swallow. And we start to see some munching or chewing patterns. So the first pattern and step for chewing is up and down movements. And then eventually we see some side to side movement, and that's the first steps to rotary mastication, which is what we do as adults. And then we also start to see the tongue move side to side, which is important for moving food around in our mouth. And then at around 6 months, we start to see that salty food preferences emerge actually. So some signs of good bottle feeding skills. Latch is one of the first things that we look for. And so I've got a picture of this little babe here in the corner. We want a nice deep latch around the nipple with the lips flanged out. What that means is the lips are kind of curling outwards instead of in on themselves. We don't want to see a lot of spillage from the milk around the lips. Usually I see it in the corner of the lips. And then I'll add to that too, I'm always looking for like little blisters on the lips. If we see that, that's a sign that's not a great latch. We want to see that babies are moving milk, so they're transferring milk. There's two kinds of sucking. There's nutritive sucking and then non-nutritive sucking, which is basically suckling, which they typically do for comfort. So we want to make sure that the babies are sucking and transferring that milk. And then we want to look for sustained and coordinated suck, swallow, breathe. So the sucking pattern is a couple sucks with a swallow, a breath, and then they kind of continue that pattern. So how long are they doing that pattern before they need a breath or a little break? And then typically when I'm looking at bottle feeding, if sessions, I want a feeding session to be less than 30 minutes with age appropriate volumes. So volumes change a lot depending on if the baby is breast milk or bottle or formula fed, and then their age. So just keeping in mind age appropriate volumes, we still want that feeding session to be less than 30 minutes. Over 30 minutes, we find that they're burning more calories than they're taking in. And then we want to feed on babies' hunger cues. So some feeding hunger cues include licking or smacking the lips, sucking on the lip, tongue, fingers, or fist, rooting, which is like turning their head side to side, typically towards, a parent when there's pressure applied to the cheek, and then rooting, and then opening the mouth when there's any kind of pressure on the chin, cheek, or lips, or crying and fussing. So when to introduce a bottle. If you are breastfeeding or plan to breastfeed and things are going really well, but you anticipate any need or desire to use a bottle in the future, it's important to introduce that bottle once breastfeeding has been established and is going well. Preferably before that 2-month mark, 2 to 3 months when the scale turns from a reflex to volitional. So if you think that you are going to be going back to work, if you want a partner or caregiver to be able to feed baby or just to be able to step out for a couple hours and bottles the way you're going to do that. Once that breastfeeding is going really well, I encourage you to introduce a bottle. And then the key there is keep introducing that bottle. So if it's going well, keep introducing it, once a day, once every couple of days if it's going well. Sometimes families will introduce that bottle and it goes really well and they stop until they go back to work. So some things to consider when buying bottles. There are a ton of bottles on the market. And so they kind of fall into a couple different categories, one of which is this wide mouth bottle here, the Komotomo, lots of different brands. Then we have narrow mouth bottles like this Dr. Brown's. We have some more, they're supposed to be more like natural shaped nipples, more consistent with like what the breast would look like. So there's a lot of different varieties. And then some like this Dr. Brown's have a built-in venting system. I find that infants who are having a hard time with latch tend to do better with a narrow mouth than a wide mouth bottle, but that's not always the case. And infants who aren't having any difficulty can go either way. But often if I have to transfer a baby to a different kind of bottle, I'm looking at the Dr. Brown's. And then I always recommend and encourage families to use pace feeding when they're bottle feeding. I find this is especially true for really little infants, so our really young ones, and then those that are transitioning between and in doing both breast and bottle feeding. So pace feeding, this is example, here's a nice one where there is only milk in half of the nipple. So it's kind of like horizontal here. And that way, when you are putting the bottle into the baby's mouth, they have the ability to pace themselves easier, because if you turn a bottle upside down and just hold it, milk will come out of the nipple slowly, but it will still drip out. And so when they're trying to pace, that can be overwhelming for them if they need to pause and breathe. So pace feeding is a really great way to kind of give them more control over the flow and how fast they're eating. I think it's really helpful when they're in between levels. So if they're not quite ready to level up to the next size nipple, this is a good tool for if we need to kind of, we're in between nipples. So when to have an evaluation? Reasons family come to me most of the time, we're looking at things like poor latch. So this kind of exaggerated photo up here, this babe barely has that nipple in his mouth. It is a really poor latch. So that would be one reason. Another would be so lips not curling out. So we talked about them flanging out. This top lip here is not flanging out. It's kind of curled in over itself, and it's resulting in a shallow latch. When we see a poor latch or shallow latch, it's often hard for them to hold. So they're having to do lots of compensating with their tongue or other facial muscles. We can find things like blistering on their lips from trying so hard to keep that bottle in. If babies are pushing the bottle nipple out with their tongue a lot, and they're showing that they're interested. So they keep coming back to the bottle, they're acting hungry, but they can't quite figure out where that tongue goes. That would be a good reason for an evaluation. If we have lots of leaking milk around the lips, clicking, coughing, or gagging during feeds, I would also say significant, like eye watering with feeds, and then coughing or reflux and vomiting either during or after feeding, and then refusal of bottle or other items in the mouth, in addition to poor weight gain. So bottle aversion. Bottle aversion is refusal of a bottle that is ongoing or new onset. It can be for a variety of reasons, including lack of exposure to a bottle, changes in feeding environment, or stress at home. It can also be because of reflux, and that reflux might be kind of obvious with like the projectile spitting up, arching of the back during feeds, but it might be less obvious, and that can play a role in it. And then it's important to not pressure or force baby to take the bottle, despite the stress that you may feel. So I find a lot of families come in, they either didn't introduce the bottle right away because they were breastfeeding, or they did, and like I said earlier, it was going well, so they stopped. And now for whatever reason, they need baby to take the bottle. They're going back to work, they're going to be leaving the home for appointments, they're having a surgery and they can't breastfeed, whatever it may be. And now baby won't take this bottle, and it's very stressful. And so we find that parents are sometimes coaxing the baby to take the bottle, presenting it very frequently and very urgently a lot. And so babies are not taking the bottle, and then it's stressful. And so it's easy to fall into this kind of cycle and this trap. So if any of those things sound familiar, if we have signs of bottle aversion, I recommend families go seek help to determine what's causing the aversion, and then how to safely and in a healthy way overcome that aversion and get back onto the bottle. Or maybe start the bottle for the first time. And then looking ahead at introducing solids, which is a fun thing to talk about. So there's a lot of new research around this. And so the new research is supporting introducing solids closer to 4 months than 6 months. We used to say they needed to be 6 months old, sitting independently before solid introduction. But now research is supporting earlier introduction. We're still looking for good head control and a minimum of supported sitting before introducing solids. So either caregiver support to keep them upright, or sitting in like a high chair and not like falling off to the sides. And then we want to make sure there's good tongue control to move food around. Research has also shown that infants who are introduced a variety of textures before 12 months are more likely to eat fruits and vegetables in the future, and less likely to have feeding problems in childhood. And those feeding problems typically included significant picky eating with limited food inventory. And then, so baby-led weaning versus more traditional weaning. So I find that with baby-led weaning, parents are offering a lot of table solid foods, and they're skipping the pureed solids. They're either not forgetting, they're kind of forgetting about it, or they're really caught in the idea of baby-led weaning, and somewhere along the lines, the idea that pureeds were bad kind of came along. Pureeds are a part of our diet, even as adults. We eat mashed potatoes, ice cream, yogurt, cottage cheese. So skipping the pureed solids, it makes it harder for those infants and then toddlers to eat those textures. It's also a really important oral motor step to learn how to eat things from a spoon. So I think baby-led weaning is great as long as we're not skipping on the purees, as long as we're still feeding our little ones from spoons and then eventually fork. And then making sure that we're offering soft solids that are still easily mashed by the tongue. So remember, going back to that motor skill, at that 6 months, they have the munching pattern. They don't really have teeth, so they're not being able to chew up really solid, hard food. So being mindful about that when we're introducing solids. And then, so kind of in that lines of thinking ahead, I wanted to cover some of my favorite kind of like feeding tools. So the first thing is high chair. So when we're getting a high chair for our little ones, it's important they're sitting upright and they're supported. That means there's a 90-degree angle from their back to their legs, so at the hips, and the 90 degrees from at the knees. And then their feet should be supported. So this high chair that I have here is actually one of my favorites. The reason why is we're looking at adjustable footrest support, and then the seat itself actually adjusts to accommodate for older children as they get older. And then when we're introducing period solids and we're, you know, in that introduction phase and we're really messy, the tray is great to kind of consolidate that mess. But as they get older, I recommend the trays come off and we actually bring our children up to the table with us, eating like family, you know, all together as a family. It sets really good feeding kind of expectations. And then it's just like feeding is a social thing. And so it's really great to start that from a young age. In terms of teething toys, a lot of teething toys we find are wide and shallow, which means that they can't move it past the front of their mouth. So I recommend things like long stick-shaped ones, and I like ones with different textures on them. So these are kind of fun. Or I've got some that kind of have little handles and still like some wider areas. But the long stick shape allows them to get back to the molar region. And then a fun fact is the gag reflex actually moves back in infancy. So it starts at the very front of their tongues and moves back as they explore more. They do this as eating, but then also in play, they teeth and mouth everything. And so that helps move that gag reflex back. So tools like this are really important to make sure that that gag reflex is moving back appropriately. When it comes to cups, there are endless options on the market. So some of my babies who actually just don't do well with bottles, we go straight to open cup, which is really fun and sometimes daunting. And so kind of down here, I have an example of, so things to look for when starting open cup with a little one. I like ones that are small volume. And then I like ones that are clear. It makes it easier for you to see kind of where the milk is in the cup. You don't feel like you're spilling it all over them, or you're not tipping it back far enough for them to get the milk. So something that's slightly clear is great. I often usually just start families on a medicine cup. They usually have a tiny little med cup that's clear at home that they can start with. And as they're getting the hang of it, progress from there. But these ones are kind of a fun option. And there's a little cutout, and that's actually where the nose would go. So they don't have to tip their head back as far, prevents them from getting as much just kind of like overwhelming volume. And then looking more at like the idea of sippy cups and straws, I like to just stay with a basic straw. There are fancy things like weighted straws, straws with valves we don't necessarily need. So I usually introduce most of my kids with a plastic like disposable straw or a reusable silicone straw. And they make, you know, straw cups now that are basic straws that, you know, are spill proof cups that are great options. And if you need a sippy cup, I just encourage that, you know, as soon as we can move away from the sippy cup, we either go to open cup or straw cup. It's more consistent with adult oral motor patterns. And then a little caution on pouches. So pouches are really convenient on the go tools, and they're great to have for when you want a mess-free quick snack. However, we found that as they become more common, that the oral motor the development is changing with children who use frequent pouches. And typically we're seeing that they're using pouches and less so purees offered on spoon. And so they're not learning the oral motor skills necessary to pull food off of a spoon with their lips and then move it back with their tongue. So, and some kids even will eat the food from the pouch, and as soon as it exits the pouch, they won't eat it. So I think that they're a great option on the go, but when you're at home or when you have time to be a little bit more messy, I really recommend sticking to spoon-based pureed solids. And then even if that means you're, you know, moving it from the pouch to the spoon and feeding it to your child, or putting it on the spoon and letting your child feed themselves. And then I wanted to include a couple of my favorite resources. So Feeding Matters is a nonprofit organization that has really great resources, but it also has a short questionnaire. So if you're ever concerned about your child's feeding skills, there is broken down by age, even down to like the months for our little ones. There are short questionnaires that'll help you navigate what is age appropriate for your child. And if there's something that's not quite meeting milestones, it helps break that down and gives you kind of a guide that you can talk to your providers with, and then kind of, point you in the right direction. And then Solid Starts, I recommend for families who are needing more support for introduction to solids and need information about, appropriate foods to offer or appropriate like portion sizes or bite sizes. And then a list of references.
Awesome. Thank you so much. You were quick and short and to the point. That was great. Great. And there was stuff that I didn't know. I mean, I have maybe grandkids, but I can't wait to pass some information on to parents too. I didn't realize that the sucking, oh gosh, now you're gonna, like at 2 to 3 months, that they are still sort of instinctively, but then after that, additional. I did not realize that. That was really, and then when to introduce a bottle. That was great. That was great because that's a question that we get all the time. So much good information, Kelsey. Thank you so much. Really appreciate it. So for anybody who is watching this or wants to recommend this webinar to friends, because I'm sure you're going to want to, parents, you can go to the, well, you've already found it, but the Family Birthing Center page. And if you scroll down at KVH, and if you scroll down, you'll find our free webinar series. And we have other webinars in that series. This is going to be added shortly, and it will be one of the great ones. We also would like to pass on to people that if you have suggestions for other webinar presentations around infants, infant feeding, infant development, parenting, please let us know. You can email us at the 4th trimester at kvh.org, kvhealthcare.org. And that's number 4, TH, trimester at kvhealthcare.org. We can reach out to local experts on those topics and see if they'd be willing to present a webinar to us, because we really want to present information that the people who are watching this would find the most useful. So again, thank you so much, Kelsey. Really appreciate it. Enjoyed it. And that's it. I think that's it.